So the basis of this session really is to try and get you writing and reading papers in a more efficient manner. So there's a real problem in that in second year there's a greater expectation that you're going to be using research papers in all of your assessments. So you don't really get away with using websites and books as much because they're not primary sources of information. And what we're interested in is your ability to be able to read a primary research paper, understand it, and then be able to write about it in a kind of useful way. So, I mean, if you want one tip this year for the whole year, stop using books, stop being reliant on books for your references, and certainly stop being reliant on websites, particularly ones that have not really got much merit, and start thinking about including, there's no perfect number, but start increasing the number of research articles that you use, journal articles that you use in your work. So with this sort of expectation, the difficulty is that reading research papers can be really hard. They can be hard to kind of understand the information, to be able to work your way through. And part of that is just because there's so much information in each paper and they're all different than one another. So, when you look at a paper and you see something to do with, say, nutrition, that will look very different than maybe a paper that's looking at sort of an exercise intervention, maybe. And the best or the way to sort of get around this is to spend years and years of reading articles, and you start to kind of understand how they're similar and how they're kind of built, if you like. But the difficulty that you've got, I suppose, with the problem is that you've only got 1 year of experience, and so you're not very good at this. And so what I'm going to try to do today is give you a framework to try and help you get better at it. So this is the solution to your problem of not being very good at it, I suppose. So the solution is to use a framework to try and make things a little bit to make things easier, to help to make things easier. So the point of this framework is that it's going to make it easy to remember, it's going to be easy to conduct, or easier to conduct certainly than the way that you're probably looking at papers right now, and it's something that you can kind of apply consistently, and so you can kind of become better at that specific process. And this framework, this solution is this PICOS idea. Now, what PICOS does is many things. So it's essentially, it describes or helps you understand how studies are built. So when you look at a study and you think about a study, again, you'll see how they all differ from one another. But when I look at a study, or when my colleagues look at a study, we see the things that are common amongst them, and that helps us to be able to kind of really understand how studies are built, such that we can kind of fast track our understanding of the paper. So this is what this PICOS framework does. So it does several things, helps you, but its primary purpose, and everything's built on this, is that it breaks down the study. It's the aspects of the study. And so because of this, it's central in helping you generate answerable questions, so thinking about rationales and aims for a study. It helps you compare studies more easily, so you can get better at doing things like synthesizing information and critiquing papers, which is some of the kind of higher level skills that we expect at second and third year. I think, and I use it personally to help me write better. But I suppose it is important to remember that it's not perfect. It doesn't fit every scenario, and we're going to see a few situations today where it doesn't match the research study identically. But when you start to realise this, you'll realise that you've understood much more about research design than you would have done beforehand. So it's kind of a bit of a learning step in itself. So the aims of the session really are twofold. First off, I'm going to try and demonstrate to you that you actually can do this. So it's not just something that I can do because I've got experience. It's something that you already will be able to do to some extent. That said, if you do struggle with it slightly, you'll need to think about practicing it. And the best way to practice it is through your assessment. So when you get an assessment, you need to read certain papers, try and go through this process and see if you can understand it and sort of refine the way that you work. And then once I've sort of demonstrated to you that you can do this, then I'm going to show you the multiple ways in which you can actually utilize it to improve your work. So At last, what is this PICOS thing? So PICOS is very simply an acronym that stands for the different components of most research studies. So we've got these 5 letters. P stands for population, I stands for intervention, C for control, O for outcomes, and S for study design. So P for population. So why is this central? Well, whenever we read a research article or research paper, we're always thinking about it in the context of the people that have been studied. So P is the first letter, and it's also the kind of first one that you should try and find each time. So if you think about this for an example, if we were to look at a study and it was looking at creatine supplementation on maximum power, all of a sudden, let's say creatine improved maximum power, that will mean something to you. And if I say creatine supplementation increases maximum power in elite athletes, that'll mean something too. So you might be thinking, okay, that's quite interesting that something like creatine supplementation can even increase maximum power in an elite athlete who already has really high maximum power. So you're thinking about it in the context of the people that are being studied. If I then say creatine supplementation improves maximum power in postmenopausal obese women, it's going to mean something very different, because then you're going to start to interpret the information in a different way. Because you might say, oh, well, that's quite useful because maybe postmenopausal women, obese women, need to increase their maximum power. Maybe they're weak for some reason. Or you could say, do we really care whether creatine supplementation can increase maximum power in postmenopausal obese women, because maybe that's just not an important thing to try and improve, and there's more important things that we could study. So everything is being contextualized based on the people that you're studying. So the first one, and also the easiest, is identifying the people being studied. So P is for population. Now the next one is actually the trickiest one to identify, and also the trickiest to explain, and it has sort of 2 components. So the first one is I for intervention. So the I for intervention is simply the independent variable. So if you're happy with the term and you understand how to identify the independent variable, you can just substitute that in here. However, students often sort of struggle with the concepts of independent and dependent variables, so I kind of think this is a little bit easy to understand and to use. So for the I in this circumstance is going to represent intervention. So if you think about an intervention, if you intervene in something, you change it, you alter it. So if somebody intervenes in a fight, they're usually stopping the fight, they're changing what's happening. And so intervention from a study point of view is when the researcher, or the research study I suppose, is changing the behaviour or changing something about the population. So really simple examples of intervention studies are, most nutritional studies are interventional studies. So if we were to give somebody sodium bicarbonate, we are making those, or asking those people to do something that they would not have done otherwise, so we're intervening. Similarly, if you were to give somebody a drug medication, so if you're going to give somebody a medication for pain, and you are studying the effect of that medication on their pain levels, you are intervening, you are giving them something that they may not take otherwise, so you're giving them an intervention. And it's the same with training studies as well. So if you're going to say, we want to study the effect of a 6-week training training program, well then that's 6 weeks of training that person wouldn't have done in that way unless you intervened and asked them to do it. So I is for intervention, and so that's it for studies that are called experimental or interventional studies. Now the E stands for exposure. Now there are lots of study designs whereby you don't actually intervene, and what you do is you observe what happens with the population being studied. So a good example of this would be most of, if not all, the studies looking at how smoking influences health. So if you think about that as an example, no one ever conducted a study where they said, we are going to make people smoke for 20 years and study the effect it has on their lung health, or how quickly they die. So they didn't intervene by giving people cigarettes. So all of those studies were that happened looking at the effect of smoking on health were all observational studies. So it was more like, we're going to ask people how much they smoke. So they've not intervened, not changed their smoking habits. They just asked them how much they smoked, and then followed them up and see the effect that how much they smoke had on their health in later life. So it's an observational study, and so because we're not intervening, we're looking for an exposure. And so in that particular example, the exposure would be exposure to smoking or people's smoking habits. So the difference between them depend on the study design. You can either find an I for an intervention, which is in an experimental study, or an exposure, which you find in an observational study. Now, as I say, these are the most difficult to find, and actually it becomes a bit easier if you've done some of these following ones. Now, the C is for control or comparison. So the control or comparison is simply what are you comparing the intervention or exposure to. So in our example of the sodium bicarbonate on maximum power, well, I think it was sodium bicarbonate. In that example, at least, if you're looking at the fact of sodium bicarbonate on maximum power, well, you want to compare it to something. And so for a study that's looking at nutritional intervention, you often compare it to a placebo control. So that is an example of a control. So the control, the C, is being compared to the intervention. Now, you also sometimes have a comparison. So a good example of where a comparison comes in is if you think about studies that are looking at new and modified drugs. So let's say a company comes up with a drug, a new drug that's used to treat pain, and they said, well, our new drug is better at treating pain than a control, than a placebo control. Well, everyone would say, well, actually, we don't really care whether your new drug is better than a placebo control because we already have pain medication that's been used for 20 years and is cheaper and more available. What we want to know is your new drug better than the existing medication for pain? And so in that case, what they would do is do a study comparing their new drug against the best existing drug for pain, and then possibly also placebo control. So that would be an example of comparing an intervention, the new drug, against a comparison, the best working drug currently, against a control, say a placebo control. So it's always what are you comparing your intervention or exposure to? And in the example of the smoking one I gave you before, which was an exposure, well, if you're looking at people's smoking habits and seeing how it affects their lung health, then you probably can compare their exposure of people who smoke to those that don't smoke. So the comparison would end up being a population of people that don't smoke. So C is for control or comparison. Now O is for outcome. Now this is quite an easy one to find or to identify. So the outcome is also known as the dependent variable. So again, if you're familiar with those terms, you can just substitute that in. If you're not, the best way to think about the outcome is what are you measuring or looking to study the effect of an intervention or exposure on. So for our example of sodium bicarbonate, we were studying the effect of the intervention, sodium bicarbonate, on the outcome of maximum power. In the smoking example, they were looking at the exposure of smoking on the health outcomes, so lung health, let's say. So the outcome would be lung health. So it's what are you actually measuring and looking to study the effect of the intervention upon. And finally, S stands for study design. So studies can be designed in all different ways. Now at first year, some of the most familiar terms, or some of the terms that you're most familiar with, are between and within designs. So a within design being studying the same people on multiple occasions, a between design studying different groups of people. So, and these are great, these are sort of simple ways of trying to understand study design. There are multiple ways you can break down studies or choose to study a particular sort of intervention and outcome. And so what you need to do is get a little bit more refined about thinking about how each study differs based on their study design, because it really has huge implications on what you can kind of conclude from the studies themselves. And so we're going to sort of introduce a type of study design today which is relevant for your assessment. Right, so this is the section where I'm going to try and show you that you kind of can do this. You already sort of have got the intellect and some knowledge about how you would identify some of these things. So first off, I'm going to take you completely away from science just to try and make the process a bit simpler. And think about a daft scenario where, let's say we were trying to plan a study looking at whether shooting towards the Trent end at Nottingham Forest is beneficial. So what I'd like you to do is For this example, and there's no correct answer for this because it depends on how you see the study, you could answer it in different ways. But what I would like you to do is, for that example of does shooting towards the Trent end, say, impact performance, see if you can go through and pick out what you think, who you think the participants might be, what the intervention is in this particular study, what a control might be for that intervention, what outcome you would look at to study performance, and then finally any terms that you might know to try and describe the study design. So what I'd ask you to do is pause the video for a minute or two, see if you can go through that process and identify these and just sort of prove to yourself that you're going to be able to do this. Okay, so if you do that now. Okay, so as I say, there are different ways in which you could choose to study this question. This is kind of I think possibly the simplest way. So look, if you're going to do a study looking at, whether shooting towards the Trent end at Nottingham Forest has an impact, say, on performance, you're probably going to use some football players. It doesn't matter who you chose, Nottingham Forest football players, young football players, it doesn't matter, but the population are going to be football players. Now, the example that I thought is that the intervention would be, well, shooting towards the Trent end. So let's say we set up a scenario whereby we made them shoot towards the Trent end for a period of time in a certain circumstance. Well, that's the question, that's the thing that we're interested in. That's what we want to find out. So that becomes our intervention, that's what we're going to change. Now, if we're going to get them to shoot towards the Trent end and look at that effect on performance, then a reasonable comparison would probably be shooting in the other direction. So shooting away from the Trent end might be a reasonable control, something to compare the intervention against, because otherwise we wouldn't really know whether it's had any beneficial or negative effect. Then finally, you could choose different things to look at performance. So some people in the seminar sessions talked about shots on goal, some people talked about possession and things like that. I thought the most obvious one was goals. So does shooting towards the Trent end, does the intervention of shooting towards the Trent end improve the outcome, being the number of goals scored? And then there are different terms you could use to try and explain study design. You could think about it as a between study design because you use the same people shooting in both directions. You could think of it as a within design, using the same people on two occasions. You could think of it as a between design, thinking about two teams playing one another in each direction. And you could think about it maybe as a crossover where you get both groups of people to do it in either direction. So it doesn't matter what you got for the study design, but it's important that you realise that it's really central in your understanding of paper, so you really need to start engaging with it. Right, okay, so the next one is I want to show you in the context of an actual research study that you can do this, and actually it's probably easier here. So this is a part of an abstract from two of our researchers here, so Dr. Mike Johnson and Dr. Graham Sharp. And what they've got here is you've just got a title, the purpose of the study, and then a very brief methods that they've used to construct their abstract. And so what I'd like you to do from this is identify those four elements, so identify the P, the I, the C, and the O. So we're not worried about study design, but I want to see if you can get to PICO. And if you look at some of the accompanying files to this seminar, you'll see a worksheet that you can work through as we go along. So keep looking back to that because the questions will pop up which will match some of the ones that I'm discussing in the seminar now. So if you print them out so that they're in front of you or have them on a different screen or something, you'll have them there and you can kind of maybe circle these on that rather than just doing it online if you like. So the first one we're going to identify is P. So can you identify the population being studied by Dr. Johnson in this particular study? So if you just pause the video for say 20 or 30 seconds now. Okay, and if you've struggled so far, here's a few options. So you could choose to do A, B or C. So if you've not managed to figure it out yet, have a look at the options that I've given and then choose one of A, B or C. So choose one now. Okay, now hopefully most of you, if not all of you, have been able to identify that the population study in this particular study or the participants are 10 cyclists. So they studied 10 cyclists, that is their population. It's their sample really. So the next one we're going to do is I. So can you identify what intervention they were studying? So same again, pause the video now, have a couple of minutes, see if you can work out how they have intervened, so what are they looking to study. So pause it now. And if you struggle to do it without the options, here are the options. Right, so hopefully you've all been able to identify that the intervention under study is the inspiratory muscle warm-up. So they have made people do or asked people to do an inspiratory muscle warm-up, and they are looking at the effect of that on something else. So the intervention is inspiratory muscle warm-up. So the next is the C, so for control and comparison. So again, what are they comparing that intervention of an inspiratory muscle warm-up against? Now if you need the options, so we've got A, inspiratory muscle warm-up, B, no warm-up, or C, cycling warm-up. So the answer to this one is both B and C. So the control, so what they've compared their inspiratory muscle warm-up against is no warm-up as a control, but they've also compared it against a cycling warm-up as a comparison. Now if you think about this, this makes absolute sense, because if they show that this new type of warm-up, an inspiratory muscle warm-up, is better for performance than no warm-up, lots of people would say, well, that's all well and good, but nobody does no warm-up. People usually do some sort of exercise specific warm-up before they compete. So if it's going to be useful for someone to do an inspiratory muscle warm-up, then we need to compare it to what people currently do, not just against nothing. And so, rightly so, Dr. Johnson and Dr. Sharp use both a comparison and a control. So a control being no warm-up, and the comparison being the sort of traditional warm-up, which is a cycling warm-up in this particular instance. So if you got that, well done. Yeah. Okay, so I was going to actually think about how this might relate to the study that we're going to do, looking at the influence of disease on cardiorespiratory fitness. But unfortunately, I've given you the answers. So I'll just take you through it. So let's say, if you can remember from the first lecture, the way that the assessment is going to work is that you're going to be able to choose which population you want to study. So you've got obesity, heart failure, a lung disease called COPD, or this post-chemoradiotherapy population who are going to go for surgery. So let's say you want to study the obese population. If we go for this process and try and pick out PICOS, it looks a little bit like this. So the population of participants being studied are the people with obesity, but also it's going to be the healthy control population. So the people being studied, the participants, the population, you can think about it any way you want. That's going to be everyone that we study. So I've actually put here participants with obesity, but actually it's probably both. Well, it is both. So if we say it's obese people and healthy people, and now we move down and we say, right, okay, so is it an I or is it an E? Well, if we're studying obesity on cardiorespiratory fitness, we're not giving anybody obesity. They're either obese or they're not obese, but we've not intervened. So it's an observational study. We're just observing the effect that obesity has on cardiorespiratory fitness. So in this case, it's going to be an E. And if you think about it, the E for us is going to be obesity again, because we're looking to study the effects of obesity. And then what we're going to compare that against? Well, we're going to compare that against healthy people. So they're going to form our control population. They're going to be healthy. So what we've got here is and we're going to study the influence of being obese on cardiorespiratory fitness. So lots of variables, but in particular VO2 peak. So that is going to be our outcome. And then finally, this type of study that we're going to build is called a case control. And this has an influence on what's going on above, because if you think about it, the P, the I, and the C are really saying the same thing. Because we're saying that the participants are going to be people with obesity and people who are healthy. And then we're saying the exposure is, well, people with obesity. and then we're saying the control are going to be people who are healthy. So it's saying the same thing. So when we've got a case control study, which is the type of design that we're going to build, you don't actually really need to worry about the participants because they are one and the same as the exposure and the control populations. So really, when we're talking about case control, you've only got to do EHP. So that's one thing to bear in mind. That's an example of where, the PICOS framework doesn't fit perfectly for a particular type of study design. So for a case control, you can kind of scrap the P, and then you're going to just look for EHP. Who is the population who've had exposure to something? Who's the control population? What are the outcomes that you're interested in? And then the study design is by definition a case control. Right, so hopefully from those slides that you've got a sense that you might be able to do this. Certainly when we've done it in the seminar sessions, we've had great success in everybody being able to do that much. There is sometimes confusion over the intervention and exposure, that's the most difficult one, but usually people can identify the population, they're pretty happy identifying the controls, they're happy identifying outcomes, and then study design is difficult and something you just need to get used to. And then again, interventions and exposures, it needs a bit of practice as well. But often, if you can find the control, you can find, you can identify what they're comparing that against. So you'll find you'll have your own specific ways of doing this, and you might start at a certain point or other. But by and large, in the seminar sessions, people are getting this right. So then, in the next stage, I'm going to tell you multiple ways in which you can use this to try and improve the work that you do. So I believe that you can use this throughout pretty much everything that you do when you're starting your research process, not because it's special or magical or anything like that, because it is just describing the central essence of what the study is. And so once you start to understand that and understand it for other studies, you start to get an idea about how it filters into everything that you do. So I'm going to give you some examples. I'm going to give you a really quick example of how it might help you become a little bit quicker searching for relevant literature. I'm going to show you how you can use it to kind of review literature and generate study ideas and rationales for papers, so kind of like introductory stuff. I think it's going to help you throughout all of your writing, but I'm just going to give you a couple of examples that are easy to sort of show in a quick sort of seminar session, which is how important they are for constructing titles and how they can be used to understand what you need to include within method sections. And then finally, possibly where most students struggle, I'm going to show you how it might be able to kind of revolutionize the way that you think about writing discussion sections. Alright, so the easiest one first. So I don't know how you conduct your search and try and find research papers, or even if you do it to this point. But let's presume that you do, and you use, say, Google Scholar or PubMed or the NTU OneSearch. There's a really quick and easy way of getting to papers that are more relevant to the subject area that you're interested in. So often what people do when they first start out is they just start to put random terms that kind of are vaguely related to their subject area, and they don't really think about how they kind of combine these things with one another to get to the outcome that they want. So I'm going to show you this briefly. So let's say we're doing a study about obesity. So our study, I'm looking at obese population. Well, if I just put obesity into the search at the top, you can see that highlighted in red, we've got almost 300,000 search results. So obviously that's too large to start sieving through them to try and find papers that are relevant to us, largely because most of them won't be. So then this here, obesity, in our example, is the kind of exposure, isn't it? So we can kind of, if we're saying we're doing a case control study, we're getting rid of the population part of it, so we're just focusing on the EHP. So obesity is our E. So the next question you should ask yourself is, well, what term can I put in next, which is most likely to find me relevant papers from the EHP framework? So hopefully you might be thinking, well, the outcome would be useful. So let's say we put an outcome in of VO2 peak, which is what I've done here. So what we've got now is E and O. So with E and O, we've now got only 150 papers. Now, some of them will be relevant, some of them won't, and you might think at that point, well, actually, I can look at the titles and abstracts of 151 papers to find things that are relevant to my particular piece of work. But you could say, well, I want to try and refine even more as a starting point so I can get the ones that are just really focused on the area that I'm looking at. And so if we've got the E and the O, and we wanted to refine it more, you've got two options really. You could either put something to do with a control in there, but that probably wouldn't be helpful in this scenario because if you just put and healthy, it's probably not going to give you too much back. or you could think about the S, which will be the study design. So let's say you just first off wanted to read any previously published papers that had looked at the influence of obesity on VO2 peak using a case control study. Well, then you would put case control in as the next part of PICOS. And if you do that, as you can see, now you've narrowed it down to 15 papers. So these 15 papers should be highly relevant to your particular area of study because each one of them should be tackling the topic of obesity. It should be looking at an outcome that's similar or is VO2 peak, and it should be using a case control design. So that's just a quick example of how you might be able to use this to not have to be conducting multiple searches for things where you can probably get to what's of most interest and most importance pretty quickly. Right, so the next one is thinking about how you can use it to review literature. And this is possibly where it's of most use. And I use it like this. So this isn't just something I'm telling you to do as an undergraduate student. I use this when I'm writing papers myself. So this is a table taken from a thing called a systematic review. Now, systematic reviews are things to become familiar with anyway because they're really important within research. And what they try to do is, rather than kind of presuming that a single research finding from a paper kind of depicts anything resembling truth, what a systematic review acknowledges really is that often in a research area you get multiple results from papers trying to answer a similar question that often conflict with one another. And so what they try and do is compare these papers to try and get an overall idea about whether a particular, say, intervention has an impact on an outcome or not. So it might be easier to think about, to give you the example what we've got here. So in these papers here, this is looking at an intervention looking at nitrate supplementation, so on exercise performance. And what I've highlighted in the green are the two studies that have shown that nitrate supplementation improved performance, and then in the red a study that showed that it didn't. And so what you can kind of see from this is, well, there's a contrast in the literature, there's contradictory information. So two studies are finding a difference, one study isn't. And so what a systematic review is trying to do is line up all of these papers so that you can make a better judgment on whether the intervention actually does improve performance or not. And then what it's additionally trying to do is say, well, if there's differences in the literature in terms of their outcome, can that be explained by some of the other things within the paper? So they often are constructed like this, and this is not by coincidence. Actually, the PICOS framework kind of came from systematic reviews. But if you look at any systematic review that's looking at an intervention and an outcome, you're going to see a table that looks very similar to this. So look what they're focusing on as the important elements of the study, because this is what they're doing here. They're saying, let's match up the most important elements of the study so we can see whether they differ from one another and whether that explains the differing outcome that they found. So what we've got in the top left is the reference. So where are we? Let's get a pen on. Right, so we've got a reference here. So obviously just who published the paper. And we've got subjects, so population or participants. Study design, that's our S. Intervention, I. And then we've got our O, is outcome. So what they've got is P, I, O, and S. And what they're missing is control, the C. And actually, I think they should have used control in this table. I mean, they may have used it in a different table and present that information, but the control is an important aspect which they probably should have told us about. But that aside, just think about it. They're trying to find out why these studies, these two positive studies, differ from this one. And they're doing it by lining up the most central elements of the research study so that they can compare it. And they match up with this PICOS idea. So let's go through this process. So what's happened is these two studies have found a difference, this one hasn't. So if we start going back to the central components of the study, we can start to try and think about, well, is there something different about this study that found no difference, so the top one, that differs from these other two, that might explain why they found opposite results? And so if we go through these central elements, so let's look at the subjects. Well, the subjects for the top study were male cyclist triathletes, the next one were male rowers, the next were recreationally active males and females. So this bottom studies used females, these other two didn't, But that probably doesn't really explain the difference that we found, because the difference is between these two bottom studies and this top one. So it's probably not to do with participants, or at least we can't attribute it at this point. What about study design? Well, the study designs are all the same. Randomized, double-blind randomized crossover trial. So it's not in study design. Intervention, we'll come back to that in a second. Outcome, well, the outcomes here are looking, well, they've looked at cycling exercise, rowing exercise, cycling exercise, and they've all looked at some element of endurance. So there doesn't seem to be a pattern in the outcome. But possibly there's a difference here within the intervention. So if we look at this here, this intervention here is using a thing called sodium nitrate. So you take that in kind of a tablet form. Whereas the intervention here is a thing called beetroot juice. Now, beetroot juice and sodium nitrate both contain high levels of nitrate. But in the beetroot juice, it's being given alongside lots of other things that are contained within beetroot juice. So maybe antioxidants and all other sorts of things. So you might start to construct a hypothesis or an idea that maybe the differences in the literature are because they've actually used a slightly different intervention. They've given people their nitrate in a different way. This one has given it as sodium nitrate, so really just giving them the nitrate alone. This one have given them nitrate alongside the other components that are found within beetroot juice. So you might use this to construct a rationale for another study, maybe comparing sodium nitrate against beetroot juice to see the effects of performance. Or you might just say, well, we're going to do another study looking at beetroot juice or looking at sodium nitrate to see whether you can sort of substantiate this finding here that found no difference. So there are different things you can do, but the central thing I want to try and get across is that by matching these studies up in this way, it allows you to start really thinking about them in a different manner. Now, what undergraduate students tend to do when they're describing studies is they describe in this direction, almost horizontally. So you'll read lots of papers and lots of stuff where you say, not papers, but submissions, where it says, you know, PICOS et al. Studied 11 male cyclists and triathletes using a double randomized controlled trial. They gave their participants a single dose of sodium nitrate 3 hours before exercise, and they looked at the effect on an exercise ergometer test, looking at the outcomes of this, and the other. And they found no difference between the two scenarios. Bond et al. Using 14 male rowers, and they just go on like that, and you're constantly describing things in this direction. Now, if you read well-written papers, they're looking in this vertical direction, and they're explaining things across studies that are central to the kind of study design. So they'll say things like, there's conflict in the literature with, 2 previous studies finding no difference in of nitrate supplementation on exercise performance, whereas one study found no difference. So they're kind of comparing, these results against this result, and then they might go on to say, potential reasons for this discrepancy between results may lie within the intervention, where the 2 positive studies used a beetroot juice supplementation, whereas the sort of null study found it used sodium nitrate. And then they might go on to explain why that might be important. But they're constantly looking at things in this horizontal direction. And when you look at your GBA grids and stuff, you often see words in there like synthesis of information. And synthesis of information is just what I've done there. I'm synthesizing the information from multiple studies and combining it to make a sort of interesting point. And you'll also see terms like critique or critical discussion, and that's what I've done here. What I'm doing is I'm critically discussing these papers and trying to find reasons that may explain the results that they found over here. And that is a world away from describing studies in this direction and then moving on to the next one and describing that study, and moving on to the next one and describing that study. So one of the things you might want to implement for across your work is to start going through this process and seeing if you can do this, and then seeing if you can pick out interesting elements that you can use to help you describe the research better. Now, and then an important sort of follow-on for this, and again something that you will never have picked up on, and I never picked up on until I was way past my PhD, is that one of the central points of writing the central point of writing an introduction is to come up with a rationale for a study. So why are you actually doing it? And oddly enough, the rationale for your study is always one of the elements of PICOS. That's always the unique part of the study. So I've just given you a few examples here. So it could be that no one has studied this population for this intervention and this outcome. So if you read this here, so they say dietary nitrate supplementation can enhance exercise performance in healthy people. So that is saying this intervention can improve this outcome. That's kind of like a known. We know this is what they're saying. But what we don't know, but what is not clear, is if it's beneficial in COPD. So there what it's saying is what we don't know is whether it's useful in this population. So the unique aspect is the population. Now in this scenario, what they're going to say is that we know that this outcome is important in this population, but no one has ever tested whether this intervention is beneficial for this outcome in this population. So older adults show an increased risk of falling, and major risk factors include impaired lower extremity muscle strength and postural balance. So that is, in this population, this outcome, extremity muscle strength, is important, and it's important because it's a risk factor for falls. That's what it's saying in the middle. However, the potential positive effects of biofeedback-based Nintendo Wii training, this intervention, on this outcome, muscle strength and postural balance, in this population, older adults, is unknown. So what they're saying is they've got a unique intervention. And then, as you can imagine, you can also have it where there's a unique outcome. So this study here is what they showed. But the possible effects during team sport specific intense intermittent exercise has not been examined. So what they're saying there is that this intervention, in this case inorganic nitrate, is important for this population, athletic people, but its potential effect on this specific outcome, which is important to those people, has not been examined. So in this case, it's outcome, and it's always one of PICOS. Normally, it's a unique population, intervention, or outcome, but sometimes it can be a unique control scenario or a unique study design that no one's looked at. But usually, and particularly in the sort of the stuff that you're going to be writing about, it's usually going to be population, intervention, or outcome. So how can you use PICOS to make writing easier? Well, we've got two examples here that you can have a look at yourself. So you can use it throughout your work. I'm giving you the example from a title, because if you think about what a title is, it's telling the reader the most important part of your study. That's its purpose, telling them how things relate to one another from their study. So you've got two studies here. You've got one from me and one from Dr. Sunderland. And what I want you to do is just pause the video for 2 minutes and see from this title whether you can pick out the population, the intervention, and the outcome. So for each one. So if you do that now. Okay, so hopefully you've done that, because this is the start of your training. So in my study here, so the population that I was studying was male adolescents. So hopefully you got that. The intervention that I was looking at was dietary nitrate supplementation. So I've supplemented people with additional nitrate. I've intervened and gave them something. And then my outcome is I was looking to study the effects of this intervention on these outcomes of acute mountain sickness and basic physiological responses. And so they're the central elements of my study. And what's important from this study is that there's also additional information here, the fact that it was drawn in the centre at Mount Everest Base Camp, which is an important element of the study, but it's not central to the study design. The study design is looking at the effects of dietary nitrate supplementation on these outcomes in these people in the context of being at high altitude. And if you didn't go through this process, and I'm sure even some master's level students now, if I asked them to sort of pick out the central elements of this study, they would highlight the high altitude part of it, and they'd be wrong, because even though it is important, it's not central to the study design. Now if we move on to Caroline's, so this one's like perfect for our purposes, because what this is saying is immediate water ingestion intervention decreases voluntary food take outcome in lean young males population. This intervention decreases this outcome in these people.
So just think about that for a second. So Caroline's decided to write a paper and give you the title describing the most interesting information, important information. All they've done is describe those three elements of PICOS, nothing more. Now, I want you to do exactly the same thing for these two papers. So again, this is someone from our department. I've done this so that you realize that this is kind of, even though they might not do it using this process, they're kind of doing it through experience, that the people that you're speaking to every day and are teaching you are doing these things, and so it's probably a good idea that you start thinking about doing them too. So this is by Dr. Mike Johnson and Dr. Sharp, and so I want you to look at this and pick out the PIO of their study, and then also this final one by someone that's not in the department, this Rookledge. So if you pause the video now. Right, and so let's do Dr. Johnson's first. So what we've got is the population. Hopefully you've established that it's older adults. Hopefully you've established that the intervention is this thing called inspiratory muscle training. And then when you try to find outcome, a lot of you will go for the effects. But that's not an outcome, is it? You can't measure effects. So there isn't an outcome in this particular slide, in this particular title. Now, what I want you to get to the point is that you can recognize that that's not there, and that actually that's quite an important thing. So yeah, so I want you to recognize this, because when I look at this title, I ask myself, the effects of inspiratory muscle training on what in older adults? So the fact that there's no outcome stated there, to me, it feels like an incomplete sentence, because you don't know whether inspiratory muscle training, or you don't know whether they're studying the effects of inspiratory muscle training on the inspiratory muscles, on exercise performance, on how much someone goes to the toilet. Like, you really just don't know from that title. So what I want you to recognize is that when that information isn't there, that you spot it, so that you can realize that actually I wish that information was in that title there, because it tells me more and it makes me be able to understand the study much more clearly. And then finally, if we go to the Rookledge one, hopefully you've picked out that not just is there the P, I, and O, but all the elements of the study design are described in this one sentence. So vitamin mineral treatment intervention improves aggression and emotional regulation outcome in children with ADHD population, a fully blinded, randomized study design, placebo-controlled controlled trial. So they've got every aspect, and that's all they've told you there is the relationship between those different parts of the study design. Okay, and then how can we use it in writing? Well, as I said, this is just an example. So that first example is, well, if you're going to start writing titles, and you are going to write a title because you're going to be doing it for my assessment, it's well worth you thinking about those central elements of the study and getting that information across to the reader, because it's fundamental for their understanding. So when you're writing it, that is what I would do. I would start off by writing, in our case, EHP, and then all you're going to do is find a way in a sentence to describe how those things relate to one another. But you can also use it for things like writing methods. So in this example here, this is an abstract of the methods. So they're just picking out the most important parts of the methods to tell the reader in this really short section where you've only got, say, 200, 250 words. So what I'm going to show you is, when you start reading the abstract of methods, they tell you most of the information about the study. So have a look at this. So for the methods, this is what they've told us. Nothing more, nothing less. This randomized controlled trial study design examine postural balance and muscle strength, which is outcome, in community dwelling older adults population, pre and post 10 weeks of bio-based Nintendo Wii feedback intervention, or daily use of ethanol vinyl acetate copolymer insoles, control, primary endpoints, outcome again, maximum strength, center of pressure velocity. So all the information they provided in their methods is related to these elements. The one additional thing they might have done is included some statistical information, but apart from that, they're telling us the most important parts of their methods. So you can do the same. You can start off by thinking, well, if my study is going to use, the population stroke exposure and control of say COPD patients in comparison to healthy people, then that information is probably going to be needed. If I'm going to look at certain outcomes, let's say VO2 peak, then I'm going to need to be able to explain to someone how I measured VO2 peak and the fact that I'm going to look at that as my primary outcome. Maybe I can provide some information about study design so that the reader can get a better sense of the way that we actually conducted the study. But it helps you to start to think about how you can construct these things rather than starting from a blank canvas. Right, and then finally, critical discussion. So the critical discussion really is only an extension of what we talked about with regards to the introduction. So if you want to make one change to the way that you write discussion sections, it's to start changing the way that you think about what you're actually trying to achieve. So my way of thinking about a critical discussion or discussion section is simply this. Let's say we were conducting a study looking at that nitrate supplementation. So this is the same table. And if you remember, this top one here found no difference, and these two studies found a difference due to nitrate supplementation. Now, all you're doing, all that's changed between you telling the reader about this important information and coming up with your rationale, all that's changed between this and your discussion is that you've conducted your study and you've got your study design and your results. So the way to write a discussion is just to think, I've now changed the nature of this research area because now I have added to this information base. So originally there was only 3 studies. These 2 studies found a difference. This study found no difference. Well, now there's my study. And so now I've got to describe what the whole research landscape looks like. Now I've added my research study and my research findings. So this can work in sort of following ways. Let's say you conducted a study and you also found that using sodium nitrate in some way improved exercise performance. Well, now what we've got is we've got these 3 studies, so these additional 2, these 2, and then your additional 1, that have all found a beneficial effect of taking nitrate supplementation. So now your discussion is probably going to take the form of one of agreement because your study is agreed with the majority of the literature. So when you're writing, you might use phrases or terms like, the current study found a positive beneficial effect of nitrate supplementation on exercise performance. This agrees with the majority of literature that's also found it to be have an ergogenic effect. And then you may say, however, a single study found no difference between or no effect of nitrate supplementation on performance, possibly due to a different way of administering the intervention. But it's going to be one of agreement because you've agreed with the majority of the literature, and now that idea that beetroot juice improves performance or nitrate improves performance looks stronger because now it's kind of 3 versus 1. Now, if you contrast that with if you found no difference, well, now you'd probably be writing in a way that talks about contrasting findings because now you've got 2 studies, your study and this top one, that found no difference, and these 2 studies that found a difference. So now the way that you write is going to take on the form of like lack of clarity maybe. So it might be, the current study found no beneficial effect of nitrate supplementation on exercise performance, which is in agreement with a previous study that looked at this, that, and the other. However, 2 other studies also, 2 previous studies found a positive beneficial effect of nitrate supplementation on performance. Therefore, it's currently unsure if nitrate supplementation is beneficial to exercise performance. Like, it's going to be one of lack of certainty. So that's what you're trying to do. And it'll change because if they've got more studies and you disagree with, like, let's say all of these studies were positive and yours found no difference, well, then that is going to be one of disagreement, isn't it? The findings of the current study are in contrast to all of the previous literature, right? So that's the first part, and that's the first element of like synthesis. And then what you're going to want to do is you're going to sort of critique the research, your research and previous research, so critical discussion. Now, the critical discussion is going to come in when you start to try and explain why you found whatever you found. So if it's one of agreement, You might then start to explain like why these 3 studies appear to have improved performance, but this one didn't. If it's one where you agree with this study, well then you're looking for contrast between your agreement between your study and this study that may contrast with these 2 that may explain the results. But all you're doing is the same process as you were done in your introduction, but now you've included your findings as well. And again, if you think about it, we're looking at things in this horizontal direction. Like, what was the overall outcome on performance? By looking at combining these studies and trying to sort of interpret it. Why might that be the case? By looking at the similarities and differences between the studies. That's in stark contrast to explaining something or describing studies in this direction with no sense of how they really kind of similar or disagree with one another. Okay, so that's the end of the kind of PICOS side of things, and I've just got a few little bits to so that's the end of the PICOS. So what I want you to just take away from it is that you can do this, and if you do it and you start to apply it in a consistent fashion, I think you'll find that it actually improves the way that you think about work, and then additionally how you kind of start to write as well. Now, I've got some additional tasks that I'd like you to do. So there's another sheet that's going to be attached on the now that you can print out, and it sort of talks about ping pong and its the effect of I think it's nitrate again on ping pong performance. It's a silly example to kind of take it away from sort of hard science to get you thinking about sort of central concepts. And so what I'd like you to do is, if you've got that and you can print it out, cut the different things into different each sentence up, and then start to separate it into whether you think that sentence should be found in an introduction, a methods, a results, or a discussion section. And the reason I'm doing this is because huge proportions of students that submit this assessment to me make really basic errors with regards to this. So putting information in the incorrect section. So stuff that should be in a methods, I find in results. Stuff that should be in a discussion section, I find in results. And so I want you to kind of show to yourself whether you know how to do this or not, because if you don't, you're literally giving marks back to the system that you've no need to, because this is something that anybody can understand and do correctly. So these are the sentences that are on that sheet, and so if you've not got the sheet or you can't print it out, you could do it here. This will also be on the version of this lecture, so the slides of this lecture, so you can potentially go to that and you can edit this particular slide. So these are the different sentences, and then what you can do is on the far left hand side of each one you can just put an I, an M, an R or D according to which section you think that particular sentence should be in. So what I'd ask you to do is pause the video now, go and find that sheet or go and find that PowerPoint presentation and go through this exercise and demonstrate to yourself like whether you can do this or not. It's going to be incredibly important. Right, now these are the answers. So I won't go through all of them, but I'll give a few examples. So there's particularly the ones that people were getting wrong in the seminar session. So 20 elite female ping pong players were studied. Well, that's a methods sentence because that's talking about our study. It's very specific. It's talking in the past tense, all things that you would expect in a methods section. Next one down, in this one here, ping pong is a sport in which 2 to 4 players hit a small lightweight ball back and forth across the table. That's an introduction sentence because that's there to kind of give a general introduction to the topic of ping pong, if you like. Actually, wait a minute, I'm going to skip on a slide. It might make it easier. Is now go through and see within these sections. So for all of the ones within the introduction, can you order them in the order that makes most sense? So, within these 2 introductions, one, it makes more sense to have one of these above the other. So can you order them in the correct manner? So if you do that now, so pause the video. Okay, and these are the results. So it's difficult to kind of talk through these in this format, so I'm just going to alter these around, but you can kind of go through and see if you got them right. I've sort of shifted them about now, so they're kind of in the final order. So introduction, methods, results, discussion, and then 1 through to 4, 1 through to 6, 1 through to 2, 1 through to 5. So now what I need to do is go through this and see whether this agrees with what you would expect. So what I've kind of tried to do here is go, this is a general introduction to the sport of ping pong and beetroot juice, because they're two central elements to the study. I've then provided what I would class as a rationale, so the reason for the study. This is the 3. I've then provided an aim, because you always need the aim. Last thing that you're going to talk about before you get onto the methods. And then we get onto the methods. And then basically I've gone through pretty much PICOS. So in this case I've gone study design, so S, ping pong players, P, intervention beetroot, control water, outcome, how ping pong was measured, another outcome with heart rate, and then finally an additional outcome being statistical analysis. Results, all I've done is describe the 2 main outcomes, and then in discussion, main findings paragraph, describing the results in respect to previous literature, describing the results considering their implications in the wider world, talking about the limitations of the study, and then providing some sort of conclusion. So that's what you should be thinking about. And then finally, what I'd ask you to do as an extension task is construct something that looks a little bit like this, which is basically a template for your assessment. So if you take the time to copy this down, alter it so it fits with what you think, and then start making annotations about some of the stuff we spoke about today, when you choose to start your assessment, it's going to be much easier to work on it based on this template rather than starting from a blank canvas. So that's really the extension task. Take this down, copy it, and then start to annotate it so it makes sense to you, that you can start to think about using it to start your assessment like today, now, so that you're already making progress on it, so that we're definitely going to be in good stead at the start of next year when we really need to put the meat on these bones, if you like. Okay, so as always, any questions, post them on there now, and I'll do my best to reply to them as soon as I can. See you next time.